WWGM, Alamo, Jackson, Dyersburg.
Online at gracebroadcasting.com.
Good News 93.1.
Here's the way to feel better, and the best way to look good too. Come and get in shape with us. It's the best thing that you can do. Health and fitness for our generation. Boomers Executive Fitness.
It's time for It's Your Health on Good News 93.1. It's Your Health is presented by Boomers Executive Fitness and Physicians Quality Care on Pleasant Plains Extended in Jackson with your host, Dr. Peter Gardner and Dr. Clifford Gerard. And now, it's Your Health.
Health and fitness for our generation. Boomers Executive Fitness.
Good morning. It's another Tuesday morning. The name of the show is It's Your Health, sponsored by Physicians Quality Care. What's the show about? Well, it occurs every Tuesday from 9 to 9:30, and it's about, by the title, it's about your health. It's a general call-in show where we encourage you to call in. Let me go ahead and quickly give you those call numbers. 663-2939, 663-2939, at which point, call in and ask a question that's been on your mind. My name is Dr. Peter Gardner. I'm a family practice physician by training, and I will do whatever I can to answer your question. And I am pleased to announce that to my left, the old crew's back together. Dr. Gerard and his posse are here. Once again, I'm sorry. I've got to come clean, especially as this is Christian radio. That there actually is no posse.
It's all a figment of your imagination.
Well, now that we're on camera, there's only so far I can push that.
It's amazing what these guys can do here with these little tricks with all these buttons.
Yeah, and to remind everyone, gracebroadcasting.com, you can go there and actually see the streaming video of the show live and archive too. So if you'd like to go back and see some of the older shows from the last 2 or 3 weeks or so, we have those archived there as well. So. And we're doing something different today, too. We have picture in a picture today.
Okay.
Yeah, so that's kind of neat.
I don't know what that is, but that's...
Well, the camera is on you two guys. This camera here is on you. We have a small camera here that's on me, and so we've got y'all in the shot, and then I'm in the corner in a picture in a picture.
Oh, very good.
Yeah,
very good.
So how y'all doing?
All right, for the Brad fans out there, have to get a little taste of that every morning. That's important.
Yes.
Once again, the call numbers are 663-2939, 663-2939. We encourage you once again to call in and ask a question. Last week we had some very interesting questions, a lot of skin-type questions, a lot of rash-type questions. Mm-hmm. We're seeing a lot of that these days, seeing a lot of, and I know we talked about it in the past, we're seeing a lot of staph skin infections. And just off the top of my head, we can talk about that just for a little bit. Mm-hmm. You know, it's funny. Everybody gets concerned when they hear the word. I hear moms come in with their kids who have a small abscess. And what is an abscess? An abscess is basically a kind of an infectious accumulation. By that, it may be like a boil. Same thing, okay? Mm-hmm. And the treatment of choice for that is to lancet. Okay, it has to be relieved. By that, it's an infection that's kind of walled itself off. And that pus is actually accumulation of white blood cells. That's your body trying to fight it off.
Okay.
All right. And unfortunately, it securely walls itself off to where blood supply can't get to it, and the more white blood cells that actually fight what is there, the infection that is there, cannot get to it. Therefore, it just kind of grows within itself, and it has to be relieved from the inside out, for lack of a better way to put it.
I got you.
Now, every mother's always concerned. She goes, I thought it was staph. They hear the word staph.
Oh, yeah.
And everybody freaks out. And it's because there's been so much talk in the news over the last decade about MRSA, which is short for methicillin-resistant Staph aureus. Okay? MRSA.
Say it again.
MRSA. Sometimes here's what you'll hear. You hear docs say MRSA. Mm-hmm. Sometimes you'll hear people go MRSA. And when they say that, what they're talking about is methicillin resistant Staph aureus. And it's exactly what that says. It's Staphylococcal aureus. There's several different staph bacterium,
Right.
okay? But this is the one that's particularly virulent on the skin. It's very common, and when it gets under the skin, it's very common on top of the skin, and when it gets under the skin, oftentimes it can start these infections. And it's been shown to be, in the past, studies documenting it's methicillin, which is a penicillin derivative resistance. And we gave this term to this type of bacterium that was particularly difficult to treat because it didn't respond. When you hear the word MRSA, you're talking about a particular staph agent that doesn't want to respond to the normal antibiotics.
Okay.
You know, a little tougher nut to crack. And in the past, it was a big deal, particularly in hospitals, because we didn't necessarily have the antibiotics available to really go after it quickly.
Right.
And it didn't respond to the common ones. So a lot of times these people had to be in the hospital and had to be put on these really expensive new age antibiotics. And the fear was, when I was in medical school in the early 90s, okay, we're going to run out of antibiotics for these things. People are going to die of skin infections. I mean, that was the concern.
Really?
It's like, well, we're already at the end of our rope now. This bacterium is reproducing itself in different ways a lot quicker than we're coming up with new antibiotics.
Right, okay.
And so we thought, well, it's going to outpace us.
Yeah. Sooner or later.
It's very soon,
Right.
okay? Because bacterial resistance happens just a couple of years. I mean, it doesn't take very long, all right?
Wow.
But what we found is that it's kind of leveled off, and what we found is some of the oldies but goodies as far as antibiotics in combination work pretty well against it.
Okay.
Okay, so a lot of the fear has been abated in that respect.
Cool.
Staph, when you were coming along in the, and doing those $1 million cardiac surgeries and everything, I mean, that was a particular concern, wasn't it, Dr. Gerard?
It absolutely was.
Yeah. I mean, you hate to do one of these perfect heart procedures and then have the guy go downhill because of a skin infection
Right.
that picked up on the floor.
Yeah.
But people become septic, they become weak. It obviously begins to affect their cardiovascular status, and it's a very, very real problem. And even today, if somebody has concomitant medical issues, by that, severe medical issues, whether it be heart failure is a particularly bad one, anything that makes them a lot weaker than the average bear walking the earth, one of these staph infections, if they become septic, and by septic, it infiltrates the blood enough to where they begin to have secondary medical problems from it. It may lower their blood pressure. It may make them, because when your body fights off sepsis, you get vasodilatation where the vessels will dilate trying to fight it, and you lose your blood pressure. And if you're already compromised cardiovascularly, that can be a big deal. People go into septic shock, and then
I've heard of that.
and then they die. Okay, and so that's a big, big deal.
And bacterial endocarditis is also a big...
Bacterial endocarditis, and we've talked about that. Last week, we had a patient that wanted to know why we gave antibiotics during dental procedures. Okay, when we discussed bacterial endocarditis, because that's a big deal. Because that's what we're primarily concerned about. We're not worried about you getting a tooth infection. We're
Right.
worried about some of that bacterium chipping off those nasty teeth. Okay, getting in under the gum line, getting into the blood stream, and making a fast A to B right to your heart, and securing itself to one of those heart leaflets. All right, and then next thing you know, you got to call in the real docs like Dr. Gerard, and they have to pull their hair out trying to figure out what they're going to do. And that's how that goes. And somebody like me gets to go, told you.
Yeah, it's sometimes one of the most difficult things to deal with.
Really?
It absolutely is, right. And sometimes you have to go all the way to having the valve that probably was just minimally involved before it got infected, completely destroy itself and has to be removed.
Right.
And the only way to treat it is to take the old infection and the area involved out of there, put in a artificial valve.
Artificial valve. So.
Right.
Yeah. Now, I will, as a little caveat, the advances in that are really quite amazing. I mean, it used to be where they'd split you open like a brim, and go in there and do it. And now they'll kind of do it with some tubes and come in your right contralateral area, and it's really amazing how non-invasive replacing a leaflet in your heart can be. I mean, I have a dear friend that had just performed last year, and there was a small incision on the right side.
So they go in through there,
Yes.
and then
Yeah, it was
and I
quite
guess
amazing.
with a camera, I guess.
I don't know exactly what it was. I mean, obviously they had to have some utensils because the valve had to be replaced.
Right.
So it was really quite amazing at Vanderbilt. They performed this.
How big is a valve? How big is it?
Well, it depends on which one we're talking about. If we're talking about the ones that goes from the left ventricle to the aortic valve, it's approximately 3 centimeters in diameter.
Yeah. When I see one, to me it always looks like a shark's tooth. You know, the old when you see people hold up a little shark's tooth, they kind of look like that. And they're about the same size to a smaller shark, I guess. They look a little bit like that. You cannot use a shark tooth for your heart valve, though. Don't start thinking that way.
They can be congenitally involved, from birth, which is a certain percentage of births. Not many, but some.
Sure.
Or you can be a developmental type thing. Used to be acute rheumatic fever was the big culprit in forming valvular disease.
Okay, and the caveat there is, why are we so aggressive treating strep pharyngitis? Okay. 2 reasons. I can just tell you real quick when it comes to strep. All right, everybody gets all concerned about strep.
Yep.
The difference between, let me just tell you what the data is. The difference between treating it and not treating it is basically you get rid of the bacteria about 16 hours quicker by treating it over the course of about a 4 to 5 day period. So it's not a huge difference.
Right.
But it does do 2 things.
Okay.
It takes 2 possibilities off the table: retropharyngeal abscess and rheumatic heart disease.
Okay.
Okay? That's what we worry about as far as the progression or the transgression of that bacterium in your throat. So that's a big reason why we treat it.
I
All
got
right?
you.
Yeah, just as so you know. Because people go, why do we worry so much about strep throat? What's going to happen? Well, most part, none. The large majority of them, 90% plus, never get treated, and people do just fine. But, every now and then it will go south on you.
Right.
And this is what happens. And once the heart becomes involved, there's you can't go back real quickly.
Absolutely.
But we don't see near so much of that now as we used to.
Well, and that's because state-of-the-art medical clinics such as Physicians Quality Care are out there treating the strep process earlier, easier and earlier and more convenient.
Okay.
So we used to see a lot of what called mitral stenosis, because of inflammation of the mitral valve, and it gets tighter and tighter, and aortic stenosis, the same thing. But we don't see as much of that anymore. We see more of a developmental aging type change in the valve. So that's why research has occurred to allow you to replace valves in people that are much older, who would be more difficult to go through the previous operations of medial stenotomy and opening the chest and pump bypasses and such. And now they have worked a way out to do this in a retrograde fashion, similar to a cardiac catheterization procedure, but which involves simply replacing and putting in a new valve without opening the chest.
Right.
That's what's been advertised a lot lately.
No doubt. Once again,
Well,
if you do have a medical question, 663-2939, 663-2939. We'd love to hear from you. Hear what's on your mind. Like I said, I like to kind of brush through the week and kind of discuss kind of what's been walking in the doors at Quality Care. Let me just add real quickly, just to let you know where we're coming from. Physicians Quality Care, if you haven't been to us before, 7 a.m. to 11 p.m. That's 7 in the morning to 11 at night, every night. That's Saturday, Sunday too. It's every night. We wanted to make it easy to remember. We can't make it any easier than that. And now we have our second location. Our first one, of course, is in the Columns. Our second one is in Milan, and it's doing well. And it's a beautiful facility. Just a little bit, we tweaked a few things, a little bit different than the first facility, particularly for the kids. There is no other kids play area like this. 3-story turret with all kinds of games and activities it's amazing. It's a destination. It's a destination place.
Yeah, can I let you in on a secret?
Yeah, what's that?
I go over there sometimes just to play.
Yeah, well, I wouldn't doubt it. A few of the things end up broken about once a week, and now I'm discovering why. Yeah, that would make sense. You may be exceeding some of the weight limits on some of the games. It's a possibility.
That's why they quit working. Oh, wow.
I think
Okay.
that slide's a little too small.
Just a little bit.
Yeah, that's there should be an alert that should go off. But once again, we've been so happy and pleased and blessed to be part of the medical community, both Jackson and Milan, and all places in between, particularly Medina and all places north of Milan. I'm learning all these neat little towns. Greenbrier and Bradford, and we actually get quite a few people from Martin. No, it's been fantastic.
I was going to say, because I was in Paris
yeah,
Sunday and saw a physician's quality care billboard.
I know.
Yeah.
Isn't that something?
Yeah, I was really surprised, Paris. But then I got to thinking, I know exactly why Jimmy did that, because a lot of people from this area go to the lake on the weekends. And so when they're coming home, because the billboard's facing, coming back this way. And so when they're coming home, they see PQC.
Hey, I mean, Jimmy learned a few things growing up in radio. He knows what he's doing.
Absolutely.
They got one over.
This isn't his first rodeo.
Got one where?
Over toward Parsons too.
Parsons.
Oh, yeah.
That's a big route to the lake every week.
That's right.
Absolutely.
Yeah,
Absolutely.
hit those lake routes. That's right.
The strategy's been revealed. No, it's fantastic. It's so far, like I said, we are pleased and gratified to be part of so many people's medical family, and we'd love you to continue to come see us. And if you haven't if you've never been to one of our clinics, come in. We'll try to make it an enjoyable experience for you. I assure you, it will be far different from any medical experience you've had in the past.
Yes,
that I guarantee.
And I can testify, because I have been a patient at Physicians Quality Care a couple of times. So they've always treated me real nice.
We're trying to get ready. We're trying to get all the guys. I'm trying to get everybody motivated and souped up and just ready for the season.
Yeah,
it's
coming.
Well, we don't get much. We used to get a huge break during the summer. Everybody kind of rest, take time off, and that kind of stuff. And we're still pretty busy. And so it's I'm having to bring in reinforcements and get some fresh faces in there. And so we've got two new doctors coming over to the Milan Clinic later this month.
Good.
And they're known in the area, and they're fabulous human beings, and we're pretty selective and protective at Quality Care. So if you're working there, it's only because you went through a fairly stringent process, primarily Jimmy and myself. And like I said, if you're just not, I don't care if your CV's 50 pages long and you've published everything under the sun. If you're just not the right personality that we need, if you just can't be, if you're tired and beat up and you still can't be good to people, can't have you. Can't have it.
Simple as that.
No, it's as simple as that. So, I mean, it's I need people that can show up, lace up, suit up, and tack the day with a smile on their face and some compassion in their heart.
Right.
I want you to hurry up and get that personnel thing fixed over there, because I've lost my main referring doctor.
Well, I know we're working on it. I'm coming back to the main clinic. I've been out in Milan for a while, so we're coming back, and we're gonna get everybody all fixed up. I'm looking forward to it. But once again, if you do have a medical question, 663-2939. We'd love to hear from you. Once again, we kind of talked a little bit about the staph skin infections, and I guess my point to the public is. It's nothing to, for the most part, these are not things to lose sleep over, but sooner rather than later, because the minute, put it this way, you may notice a boil on yourself, you may notice a boil on your child, okay? Give it a day or two, okay?
Right.
And if it, most people have excellent, immune processes, and your body will one of two things is going to happen. It's either going to go away or it's not.
Right.
I mean, it's not going to kind of smolder there generally. Okay, so if it doesn't look like it's getting considerably better over a couple-day period, just give it a day or two.
Okay.
If it's not, then it's not going to. Come on in, okay? And let me tell you, it's a whole lot easier if you'll come in and let one of us drain it
I was just fixing to
cosmetically,
ask that.
okay? Because if I drain it, I can pack it the right way, and I can make it look good. Cosmetics are important, you know, and,
Sure.
I listen to
Right.
that, and particularly on young ladies, all right? And young girls become young ladies. So you got to think about those things.
Exactly.
They don't want a huge scar on any visible part of their body. That could be tragic when they're 16.
Absolutely.
Absolutely. They'll hate you for it. So my point is that don't sit there and just try to jab at it yourself, because a lot of times that does complicate it. By the time I see it, all right, the infection will have evolved and become, cosmetically it becomes a little more difficult for me to make it look good if you've tried to drain it several times yourself. And that's just the reality of it. If you'll come in before it gets that way, before it walls itself off and starts to become a little more complicated in the inner structure, I can make it look pretty good, and we can just move forward, and it's not a big deal.
Right.
So that's my point. And there are antibiotics that work extremely well. The sooner, the better, and we can go from there.
Yeah, you'd get the blame for that. You know, if somebody did it themselves, then they come to you and
know.
you don't fix it. And then, you know, they'll say, well, that Dr. Gardner's messed that up.
I'm sure that's out there. I mean, that's probably been said over many a coffee table for years and years and years.
I doubt that. I doubt that.
No, but I do think about those things, and like I said, because it's no one needs those kind of things. I mean, the boys, even when they're 7, they don't care. Okay,
Right.
But the girls,
Yes.
like I said, no one wants a big scar on their anterior knee.
Guys
or
kind of
something
like
that.
it.
Yeah,
You
it's
know,
fine. They don't
like a
really,
badge of honor sometimes
They
when you
don't
have a
really-
scar.
They don't really, sometimes the moms don't want the scars on the young boys.
Yeah.
But most of them are like,
Yeah.
But the girls, they can already, if they're of that age, I guess it's probably about 10
Yeah.
where they start going from, being little tomboys to being like,
Yeah.
I kind of want to start looking like a girl.
Right.
You can tell they're concerned. They don't want a scar.
Exactly.
Yeah, the boys used to like this red badge of courage stuff,
That's right.
particularly the guys with the flat nose before the days of face masks. if you saw a guy like that, you knew he was tough.
He was tough.
That's right. You can take a few. Yeah, no doubt about it. No doubt about it. So what's new in the world of cardiology, Dr. Gerard? Real quickly.
Well, you got me on the spot.
I know. That was tough. That was a tough one.
Well, I think the latest thing that's happened here, which reflects, considerable amount of research to get this done, is taking care of people who are in their 8th decade or so who have developed stenosis of the aortic valve.
Okay.
That is a narrowing of the aortic valve, a degenerative thing, not an inflammatory thing. And so, therefore, these people used to dread being operated on. It was, and yet it would become a life or death type situation. But it has been developed here, and of course, I was not there when it happened. It's happened since I was in that particular arena. But they have developed a way to go in and repair that valve, not repair it, remove that valve and replace it.
Okay.
Without, as I said, big, long incision and long time on the cardiopulmonary pump situation, long-term recovery phase, and yet these older people can get by with less trauma
Right.
and have good results. I guess that's the latest big thing.
It's funny you bring up the later decades. Real quickly, what you see a lot of, okay, in the elderly is isolated systolic hypertension, okay, and it goes untreated. But that we see a lot of people that come in by isolated systolic hypertension. What we're talking about is when you hear somebody's blood pressure, the systolic and the diastolic. The systolic is that first number. Okay. In a perfect world, we like that to be less than 120. The diastolic, okay, is that second number, and we like it perfect world to be less than 80. All right, but we'll see isolated systolic hypertension. We'll see that high first number with a moderate to minimally elevated, if not even normal, second number.
Okay.
Like we'll see 175 over or 170 over 85 or 88 or 90.
Okay.
And you see a lot of that as people get a little bit older. And we used to just kind of, for lack of a better way to put it, to use a colloquial term, just kind of say, we just kind of blow it off and say, well, the diastolic number looks good.
Yeah.
So we're going to let that go. But now, the evidence is that we should treat that. We should treat the systolic hypertension.
Okay.
And the most common way to treat that is with a very simple medicine, a thiazide diuretic. It's good, it's common, and for those out there listening, it's extremely inexpensive. It's cheap. It's about a $4 medicine on just about everybody's list. When you say, Dr. Gerard, a thiazide?
I would. And the main reason it is so effective is that it reduces the amount of sodium in your system.
Correct. And Dr. Gerard mentions this quite often, but if you can do just a couple things, number one, see your doctor, and if you notice your blood pressure is high, say something to the doctor. Because I'm not saying the doctor's disinterested, but they're looking at a million other things, and sometimes a little bit of a blood pressure workup takes a little bit of time, but you have to be concerned. You have to be your own health advocate. Let me just add that real quickly.
Right.
Because no one is going to care for your health as much as you do. All right? I love everybody that comes in that door, and I want to help every one of them. But I tell you what, I listen a lot closer when someone says, hey, doc, I want you to look at this. Because then they're concerned.
Right.
And I need to zero in on that. And so don't be afraid to do that. I mean, and if your doc doesn't like it, then fire that doc and go somewhere else.
Exactly. Make a list, I guess, right?
Well,
because
you can make here's what I would ask you to do. Okay, a list is fine.
But not 2 pages.
Well, correct. If you can limit to 2 or 3 things, in the order of their priority, okay? Because the doc's time is a little bit limited. But like I said, if you can go in there, and everybody gets a little nervous, and people get a little tongue-tied when they're trying to talk to me sometimes, and I try to just calm them down and say, tell me what's real important to you today, and let me just tell you, whatever we don't get accomplished today, I can see you back in a couple of weeks, and we can start going through this.
Sure.
Because sometimes you have to time certain labs, and like I said, here's what most people, we've discussed this before, here's what most people want. They want a plan. Doc, just tell me there's a plan.
Yeah.
I don't care if it takes 1 month or 6 months, but tell me that we have a process and a plan in your mind to get me better.
Right.
Okay? Because people, by the time they come in the doc, they've been thinking about a problem for 6 months.
Sure.
Easy.
Right.
So they're okay with the time periods for the most part. They just want to know that you're not just kind of walking in there, looking at their chart for 30 seconds and going, how can I get this person out the door?
Right.
They want to know that, like I said, you've looked at a few things. You look at some past visits, and that you've made an individual plan for that patient. That's what they really want. And as far as the what Dr. Jordan mentioned, salt intake is huge. Table salt. There's really no reason for it anymore.
You're right.
If you want to sprinkle some on your watermelon or your corn on the cob, other than that, there's really just no reason for it. There's enough. We'd love for everybody to eat fresh foods. Let me just tell you, and stay away from processed foods. They're all overladen with salt. But let me tell you, there's enough salt in the kind of foods that you get if you buy anything at the grocery store that's just not off the fresh market. You don't need to add table salt to it. You just do not. Sodium content is just huge these days. Try to keep it under 2 grams.
I think it's habit. I think for most people, it's just habit.
Of course it is. But you can break the habit. I was a huge salt user. And about 30 years ago, I just decided, this is, let me see if I can go without it. It was tough for about 4 or 5 days.
Yeah.
And after that, it's like going from Cokes to Diet Coke. I could no more go back to a regular Coke now. It would taste like I was drinking corn syrup. I taste the salt that's already in foods to such a large degree.
Yeah.
Thought of putting salt on it additionally would make it so distasteful. And believe me, I'm the common denominator. I am nothing special. And so if I can do it, anybody can. It's plain and simple.
Just do it.
Just do it.
Yeah.
You'll be surprised. You'll call back and say, you know what, Dr. Gardner, you were right.
And you like to hear that, don't you?
Well,
Dr. Gardner, you were right.
I don't hear it enough. Docs need pats on the back, too. We get discouraged sometimes.
Yeah, most of the time when somebody's calling, it's not to tell you you're doing a great job.
Like, it's like, and it's usually the ones you've bent over backwards for that they're like, so dissatisfied, you have to go, well, that's just human nature, and it's just the way it is. Once again, I hear the music. The name of the show is It's Your Health, sponsored by Physicians Quality Care. 2 locations, Jackson and Milan, 7 a.m. to 11 p.m., always accepting new patients. Come by and let us be a part of your medical family. Take care. Look forward to hearing from you next week, and God bless.
Here's the way to feel better, and the best way to look good too. Come and get in shape with us. It's the best thing that you can do. Health and fitness for our generation. Boomers Executive Fitness.
You've been listening to It's Your Health with your host, Dr. Peter Gardner and Dr. Clifford Gerard, presented by Boomers Executive Fitness and Physicians Quality Care in Jackson. Tune in next Tuesday morning at 9 o'clock for It's Your Health, right here on Good News 93.1.
Health and fitness.